I think if you talk about health, you look at about health, what is the indicator of health performance? What do you think? How do you judge the performance of a health system? What do you think?
Health facility, health services.
What is the performance? Like if for instance, you talk about maternity, yeah? Maternity. What is the best indicator of how well a maternity system is?
Child mortality.
Mortality.
Child mortality. So if you're going to look at that, when you look at the performance of a system, you look at the right indicators. You can have a perfect way the indicators. One indicator of maternity is child mortality deaths. If the deaths are going down, but the percentage of all children born and those that die, if that's going down, that system is improving.
So, but that's just the basics.
No, that is
The issue also there is the hospital doors are broken.
Oh yes, of
The
course.
fence are broken. The toilet is not functioning. They don't have water because of infrastructure issues with WEF. That has been there for years but has not been fixed for Suva and Rewa Street areas.
Yes, that will continue to be the challenge. There is a challenge with the infrastructure. As you know, a lot of it is legacy issues in terms of water, the old piping and all that. And you know that for water, for instance, the non-revenue water is running at around 47%. Part of that is water that is stolen, water that is leaking. They have additional problems that they need to deal with. Particularly in the Suva to Nosori area, the influx of people is very high. That means at the same time, if you have a fixed amount of money, you have to decide, am I going to use this money just to get rid of the old piping and put it in, or also use a significant portion of this money to the new people that are coming in that need access to the water. You need to balance it out. And you can see that over time they have their 2050 water strategy. For the water authority, they need to be able to address this. But at the same time also, before this government came in, they were saying they're going to come in 1 and 2 years and fix all of these problems, as if it all of a sudden they had a magic wand and it would happen. I, as a former Minister of Water, I know that that is not possible. What I am saying in terms of health, the ultimate arbiters of whether or not the health system is working is to look at the key health indicators. Key health indicators in all the different sectors. We do have challenges. Mortality for children, mothers dying, those things have decreased over the long term. But you still have those problems for the infrastructure, especially CWM. That's an old facility that you have there. Everybody knows that we need a bigger hospital. Everybody knows we run out of beds in CWM for the specialist facilities. You know what they've done? They've extended Valilevu. They have people can stay in Valilevu now. They're extending the facilities at Makoi so that they can move people out of CWM. It's going to be something that they need to work. They need to throw a bit of more money into that, improve their systems. But and that's why I said ultimately you got to look also performance of government in terms of what they said they do and whether or not they've done it. I know the challenges. It's not easy. These things are not easy. But this government said that it promised that it would do it, and it's not doing as well as they said that they would do it. And I think now they realize how difficult it is because things are systemic and people think work together. Within the confines too of how much money that you have and how much money that you're spending for all your different competing interests. It's not going to be easy.
In terms of health, may I also say that you need to look at it in the context of the difference between public health facilities and private health facilities. Most Fijians, they prefer to go to public health facilities because free or low costs. It's a matter of affordability. And during COVID, this is one of the experience when we visited, when we looked at the facilities. I asked the question with the doctors, why is CWM in such a state? And this is the answer from one of the doctors. Sir, there are so many sick people in Fiji, and it never ends. Now we are just dealing with COVID, but there has never been a time where the CWM is empty. So the question of where do we take with these sick people if we want to fix CWM or we want to build a new hospital facility? But that's CWM. But we build Nakasi health facility, upgrade in what do you call
Makoi.
in there's a maternity whatever in Makoi and Valilevu, Nabosa Hospital and whatever. I think for every government, you just come in and continue
to the next level,
to go to build to the next level. Because not every government will address the problem. That's a reality for Fiji, but I think it's a matter of, doorknobs, whatever. People steal the starters for the tube lights from the hospitals.
In the
What can you do
hospitals,
about it?
people steal.